So we're here in the Cardiac Cath Lab at Wooster Community Hospital. We started the Cardiac Cath program here in 2001, where we started doing diagnostic heart caths here for the community. In the past few years, we developed and implemented our coronary PCI, or our coronary stenting program, and that allows us to actually keep patients here locally. So here in the Cardiac Cath Lab, we look at the blood vessels that supply the heart oxygenated blood. We take a thin catheter or a thin plastic tube and we run that into the heart and we inject contrast, and the contrast fills the coronary arteries and we check for blockages. Once we find where that blockage is, we can then take a tiny balloon and inflate that balloon in the blockage to open it up. And then after that, we can take a stent, which is like a little wire mesh, and we put that in the blockage and inflate that stent, and that acts like a metal scaffolding, and that helps keep that artery open long term. Now, these are actually stents that we use in the arteries in the leg. The stents that we put in the heart are a lot smaller. These are what helps keep the blood vessel propped open after we do a balloon. Before we started this program, if a patient came to the hospital with a heart attack, those patients had to be either flown or taken by ambulance to a larger tertiary care center. Now that we have the program here, we can fix those patients safely and kind of intercept the heart attack before it causes long-term irreversible heart damage. One of the neat things that we do here also is we do your cardiac cath through the wrist or the radial approach. Traditionally, cardiac caths are done through the groin. When we go through the wrist, we don't have to worry about bleeding as much, and it's safer for the patient. We also do procedures that deal with more of the electrical side of the heart. This is actually a loop recorder, and the cardiologist will put this little device in under the skin in the chest, and this device here will actually measure a patient's EKG continuously for up to 3 years. We also do pacemaker procedures here. This device here goes under the clavicle, and then there are leads that come off the battery and go down into the heart. This is a little bit larger device called a defibrillator or an ICD. These devices actually deliver a shock and help restore a normal heart rate. One of the things that we look at with our heart attack patients is called a Doortoballoon Time. Our average Doortoballoon times are below 60 minutes. The American College of Cardiology wants all of the heart attack victims to have their vessel open within 90 minutes. So I'm proud to say that we are meeting that benchmark safely. Our quickest Doortoballoon time here is 15 minutes, which means a patient came into the door with a heart attack, and 15 minutes later we had that blood vessel open here in the cath lab. With the accreditation of our cardiac cath program by the American College of Cardiology, that ensures that we have instituted best practices to focus on the patient getting the best patient outcome for their cardiac care. We are here 24/7, 365 days a year to provide this care to you and your family.